A new study published in the journal Social Science and Medicine has revealed that income inequality, wealth inequality, rising wealth inequality is in fact linked to adverse health effects in poor people, specifically low-income children. Now, here's what they did with this study. They looked at data, national economic data. They looked at data from the National Institutes of Health. They looked at data from the CDC. They looked at, different locations all throughout the country. And what they found was that children growing up in times of increasing, rising wealth inequality suffered more frequently as they got older of heart disease, diabetes, chronic lung infections, and all sorts of other socioeconomic related health problems. And it all is tied directly, according to this study, to wealth inequality here in the United States. The worse the inequality gets, the worse the health problems for poor people. And it's not a mystery as to why, folks. When more wealth is concentrated at the top, there's less wealth down at the bottom. When there's less wealth down at the bottom, people aren't able to go to the doctors and treat conditions before they get worse. You can't afford to go in there and monitor your blood sugar when you're pre-diabetic, so you don't even know that you're hitting that point. So eventually you hit full-blown diabetes because you didn't have the test telling you to change your lifestyle, change the way you do things before it becomes irreversible. Same thing with heart disease. You can't afford the screenings, you can't afford the blood work to test your cholesterol and all of those things. So boom, you end up with heart problems later in life because you couldn't afford to get tested. You can't afford an asthma inhaler, you can't afford the steroid inhaler to strengthen your lungs every day, so you don't need a rescue inhaler. So you have more chronic lung problems as you grow older. Not to mention the fact, and this is, geography based, most of these poorest people in the country happen to live in areas that are also heavily polluted. And that contributes to heart disease, to lung disease, to all kinds of endocrine disorders. Poor people get screwed in this country more than anybody else because that's the way it's designed. And that's what this study is telling us. We're killing people because they're poor. That's what's happening here in the United States and has been happening for decades. And this study is just the latest bit of proof that we have to show that this is happening. And we have to reverse this. We have to reverse the income inequality. Bernie Sanders has legislation out right now saying, let's put a windfall tax on these massive corporations that are price gouging us. This is going to slow down that rise in inequality. Let's push for higher minimum wages. Let's push for more unions because, hey, guess what? In areas where unions are stronger, these health effects are lessened. So that's an interesting little tidbit there. Push for the unions. Get people better pay. Get people better benefits. Push for universal health care, and we could probably eradicate most of these differences in health quality between the poor and the wealthy. There's very real solutions out there. There's very real solutions that are relatively easy if we had the numbers to pass them. We could save lives, but as a country, we're literally making the choice to not do that.
This is Hattie. Hattie wants to know why you have not subscribed to our channel. You obviously like our videos, so do us a favor and subscribe.